In the previous teaching video, I mentioned that Goldmann applanation tonometry was a more accurate way of measuring intraocular pressure compared with non-contact devices. However, it's important that we distinguish between the terms accuracy and precision. The accuracy of a measurement refers to how close that measurement is to the true reading, whilst precision refers to the repeatability of the device. Because of the effects of the cardiac cycle on non-contact tonometry measures, it would be more correct to say that the Goldmann device gives a more precise measure of IOP. In reality, the accuracy of all tonometric devices is affected by corneal characteristics. We're trying to measure the pressure of the anterior chamber, and the cornea literally comes between us and the truth. In this teaching video, we will show you how to measure central corneal thickness using a pachymeter, and also introduce you to two new tonometric devices that are thought to give an IOP reading that's less affected by corneal characteristics. More information on these devices will be given in your lectures later this year. Pachymetry describes the technique used to measure corneal thickness. It can be performed using optical, interferometric or ultrasound techniques. In the following video, we will use an ultrasound pachymeter.
Hello, I'd just like to check the thickness of your cornea, starting by putting a drop in which will numb the front of the eye. So if you could just look up, it may sting a little. And here's the tissue. If you could just hold it there in the corner. Well done. And I'm going to clean the pachymeter tip using an alcohol swab. Normally I'd let it air dry, but I'm going to use a tissue to make it a little faster. Now if you could just look at the letter A over there, and I'm just going to hold your lids. Well done. Thank you.
As the sound waves pass through the cornea, they reflect or echo from the posterior corneal surface. By knowing the speed of sound waves emitted by the probe and the time it takes for the posterior corneal echo to bounce back to the detector, the corneal thickness can be calculated. Remember to apply the probe to the central cornea and rest your hand on the patient's forehead if necessary.
So this patient's average corneal thickness is 597 microns, which is slightly thicker than average, meaning that intraocular pressure measurements may be overestimated.
Ultrasound pachymetry is a contact technique for measuring CCT. In your lectures, we will discuss how corneal thickness measurements are used to evaluate the IOP measure, but suffice it to say, using nomograms to correct for the corneal thickness effect on the IOP measurement is neither valid nor useful. The central corneal thickness measurement should only be used to give you an indication of whether your IOP measurement is relatively over or underestimated.